So can you fix Hashimoto's disease? Absolutely, yes, you can. You can put it into remission. But how do you do that? So let's talk about some of the things you need to look at if you want to have a chance of putting this into remission. I'm Dr. Scott. I've been helping people for over 20 years, and I've helped thousands of people put their Hashimoto's into remission. First, let's cover one thing that you really need to understand. If you're taking thyroid medication, and if you are, put down in the comments what type of medication you're taking. Now, and it doesn't matter which medication it is, whether it's Synthroid, #1 prescribed medication in the United States, or levothyroxine, Triason, Armour, NP-thyroid, Natrosroid, Levoxyl, okay, liothyronine. It doesn't matter what medication you're taking. You need to understand if you're taking this medication, you will never, ever be able to put your Hashimoto's into remission. Ever. Here's why. It's because it's a hormone replacement medication. It's replacing the hormone that you're losing because Hashimoto's, right, is destroying cells. It's not fixing the reason why those cells are being destroyed. You're going to continue to have more cells destroyed over time. And with some people, it destroys the entire thyroid completely. So if you're going to a doctor and the only thing they're doing for you is giving you hormone replacement like Synthroid, well, what you can expect is to have symptoms the rest of your life that will get worse over time. So it's time to get another doctor, or at least get to someone that knows how to put this into remission. What things do we need to do to put this into remission? First off, don't stop taking your thyroid medication. You actually do need it for the time being. Until we can find out what's driving your immune system to attack your thyroid, you're gonna need it. Now, half of our patients are able to come off thyroid medication. Now, their doctors take them off, not us. First thing you need to do is get some blood work done. You need a full thyroid panel, which includes 10 markers. Not 1 or 2, but 10. Most of our patients that have Hashimoto's disease don't have just Hashimoto's disease. They have some other contributing factors, and the only way to know that is to get the full thyroid panel. Secondly, you need some inflammatory markers like ferritin, homocysteine, C-reactive protein. What your blood sugar is doing is at 85 to 110 all day long, and really that should be without medication. Secondly, adrenal function. Adrenals are driving sometimes what the immune system is going to be doing. DNA, almost all of our patients will get some DNA testing. We're looking for some genetic variants that can contribute to why they're having symptoms. And this is just the tip of the iceberg. Okay, so you have to look deeper into this. If you're not looking into these things, you're never going to feel better and you're going to get worse over time. You know that because it's happening to you now, right? So if you're tired of being sick and tired, reach out to us. You can DM us, you can email us, go to our Linktree link and schedule an appointment or a free discovery call with us so we can sit down with you and help you put together a strategy of getting your life back because you do deserve it.